Arcticum lapa, commonly known as burdock root, is a popular plant in traditional Chinese medicine, and it's commonly promoted as a nutritive food. For hundreds of years, burdock has been used as a culinary ingredient, which is normally boiled down in soy sauce in Korea and Japan, and is frequently ingested. Burdock is a strong antioxidant, as it can upregulate antioxidant levels and improve stage 2 detoxification. For example, in the brain, burdock increases antioxidant genes. Burdock may be as strong or even stronger of an antioxidant than vitamin C. Burdock protects against LPS-induced inflammation. Burdock helps with the removal and the protection from some heavy metals, like cadmium, for example, where it protects the testicles, the kidneys, the liver, protects from DNA damage, and protects the brain. It can also help in the removal of mercury. Burdock can enhance mitochondrial biogenesis and fatty acid synthesis. For example, in muscle cells, arctogen from burdock can dose-dependently increase ATP levels. It also increases the levels of cytochrome C and uncoupling proteins. You can check out my video on the mitochondria for more information. Burdock may have anti-aging properties. For example, materacenol can increase the lifespan of worms by 25%. Burdock root may improve levels of luteinizing hormone, follicle-stimulating hormone, and testosterone. Burdock is a phytoestrogen, and it can bind to the estrogen receptor, similar to selective estrogen receptor modulators, or SERMs, and act as a natural alternative to estrogen. Burdock root can protect reproductive organs during use of the antibiotic gentamicin. It can also protect the testicles from cadmium-induced damage. In models of diabetes, burdock root extract was able to improve sperm count. Burdock may help with erectile dysfunction and premature ejaculation. In animal models, burdock root can increase the frequency of sex and ejaculation, similar to Viagra. Burdock has anti-biofilm and antibacterial effects, similar to beta-lactam antibiotics. It has antibacterial activity against many strains, such as E. coli, H. pylori, Salmonella abenni, and many more. Burdock has antifungal activity demonstrated against Aspergillus niger, Candida albicans, and Candida tropicalis. Burdock has antiviral activity demonstrated against adenovirus, herpes virus, HIV, H1N1, and PCV2. Burdock has antiparasitic activity as demonstrated against Schistosoma mansoni. Burdock can inhibit mast cells and reduce allergic inflammation. It can prevent immunoglobulin E-mediated allergies, as well as an anaphylactic shock, and stop mast cells' release of histamine and inflammatory cytokines. In arthritis patients, burdock tea consumption of 6 grams per day for 42 days was able to reduce pro-inflammatory cytokines and improve inflammatory status and oxidative stress. Burdock root can improve diabetes by reducing blood sugar, improving glucose tolerance, and preventing pancreatic cell death. Chronic oral administration of arctogenin can lower blood glucose and improve lipid metabolism. Arctin can decrease levels of the HbA1c, triglycerides, and VLDL, while improving levels of insulin, HDL, and leptin. Insulin and cysterol beta-D-glucopyranoside from burdock can also help positively regulate blood glucose levels. Arctogenin can reduce inflammation in the gut. Fermented burdock root may improve the levels of bifidobacteria in the gut, increase levels of organic acids, including lactate, acetate, propionate, and butyrate, and reduce fecal deoxycholic acid, which is a risk factor for colon cancer. Fermented burdock root may also improve levels of secretory immunoglobulin A and mucins, which are a biomarker of intestinal immune and barrier function, and reduce fecal lithocholic acid, which is a risk factor for colon cancer. Arctogenin can also protect against formation of ulcers and enhance their healing. Arctogenin can reduce the Th1 to Th17 induced inflammation in the gut, and arctogenin may help prevent leaky gut and improve tight junctions in the intestinal barrier. Burdock may help to reduce oxidative stress, decrease muscle damage, and improve exercise performance. In multiple studies, burdock and its bioactive components have shown to improve physical performance and endurance, reduce physiological fatigue, and improve grip strength. For example, arctogenin increases exercise endurance by increasing antioxidant levels in muscles and reducing fatigue from exercise. Chronic administration of arctogenin in animal models was able to significantly enhance swimming endurance by activation of AMPK and reduce fatigue by 30%. Arctogenin is so strong at reducing exercise-induced fatigue that it was able to improve exercise endurance during treadmill running in fully sedentary animal models. Burdock also reduces the levels of lactate, ammonia, creatine kinase, and BUN in muscles. Arctogenin may also reduce fatigue by its ability to increase dopamine in the brain. Burdock protects liver against oxidative stress by helping increase its levels of antioxidants such as glutathione. Burdock also increases cytochrome P450 activity, helping to alleviate the severity of liver damage from some toxins. It can also help reduce levels of ammonia. Burdock can also help against cadmium-induced liver damage, while caffeic acid in burdock root can prevent nickel-induced liver damage. Burdock can also prevent liver damage from acetaminophen overdose. Arctin may help with fibrosis and scarring in the liver also. In the kidneys, arctogenin can reduce inflammation and increase antioxidants. It can prevent oxidative stress during kidney infections. It can also prevent and reduce fibrosis of the kidneys. Burdock can also help to treat urinary tract infections. Arctogenin reduces neuroinflammation, which is inflammation in the brain. Arctogenin can polarize M1 macrophages to M2-like macrophages, which turns brain cells from a pro-inflammatory state into an anti-inflammatory state. Arctogenin can also activate silent information regulator 1, SIRT1, signaling in the brain, thus helping neuroinflammation. Cholinergic acid can prevent neuroinflammation from heavy metals like methylmercury. Arctogenin has therapeutic efficacy in experimental models of influenza virus and Japanese encephalitis. Arctogenin can also reduce viral load and viral replication within the brain, reduce neuronal death, and reduce secondary inflammation and oxidative stress resulting from microglial activation. Arctogenin can improve the movement by upregulating dopamine to GABA in Parkinson's disease patients. You can check out my video on Parkinson's disease for more natural health tips for this condition. Burdock can help with excitotoxicity. For example, in the brain, arctogenin can protect the hippocampus from glutamate-induced toxicity by binding to kainate receptors. Burdock root can protect brain cells from neurotoxicity and cell death after alcohol intake. Burdock can also protect against alcohol-induced liver damage. Burdock root can protect the brain during traumatic brain injuries and stroke. After ischemic stroke, arctogenin can reduce neuroinflammation and stroke damage. It can reduce the swelling of the brain after a subarachnoid hemorrhage stroke, decreasing brain water content in a dose-dependent manner and improving a leaky blood-brain barrier. Also after a stroke, arctogenin can accelerate the rate of brain healing and reduce the levels of lactate dehydrogenase in the brain. You can check out my video on stroke recovery for more information about naturally treating this condition. Arctogenin can improve memory in models of Alzheimer's disease. One way it does this is by its ability to increase the neurotransmitter acetylcholine in the brain via inhibition of acetylcholinesterase. It can also help promote the clearance and reduce the buildup of beta-amyloid-induced neurodegeneration and prevent hyperphosphorylation of tau proteins. Arctogenin also improves autophagy in the brain, which is recycling of brain cells, by inhibiting the mTOR pathway. You can check out my video on Alzheimer's disease for more natural treatment options. Arctogenin in burdock root is a potent anti-tumor agent. Its demonstrated anti-cancer activity against bone cancer, brain cancer, breast cancer, cervical cancer, colon cancer, gallbladder cancer, leukemia, liver cancer, lung cancer, pancreatic cancer, prostate cancer, renal cancer, skin cancer, and stomach cancer. In prostate and breast cancers, arctogenin synergizes well with polyphenols like quercetin, green tea, and curcumin. Burdock may increase chemosensitivity in cancer cells. In phase 1 clinical trials, GBS1, which is a specific extract from burdock, can make cancer cells more sensitive to glucose deprivation. Eating burdock can help with weight loss. For example, in a study of 8 weeks, repeated oral intake of burdock root resulted in a body weight decrease and blood glucose suppression. Arctin is able to reduce weight gain in animal models fed a high-fat diet. Burdock can also increase brown fat, which is more fat in the mitochondria, while reducing white fat accumulation. Burdock can improve skin aging, elasticity, and collagen synthesis, and reduce wrinkle formation. For example, burdock has shown to increase the levels of antioxidants in the skin, as it's able to inhibit elastase and pyranase. It can reduce the action of alpha-melanocyte stimulating hormone to induce melanin production in the skin. In a clinical trial, burdock was able to improve symptoms of acne vulgaris. Burdock may help to increase wound healing after burns and help prevent infections. The polyacetylene ingredient in burdock may have potent antibacterial and antifungal activities in some skin conditions. Arctin can potentially protect skin cells from UVB radiation and may be useful as a sunscreen alternative also. Burdock may be useful in treating tooth and gum disease that's related to microorganisms in the oral cavity. Arctin can improve heart function and prevent the enlargement of the heart. Burdock may help with hypertension, as lignans found in burdock have shown to be potent platelet activating factor receptor agonists and calcium antagonists. For example, in animal models with hypertension, burdock can reduce blood pressure. Burdock may help with atherosclerosis and cholesterol buildup, similar to simvastatin. Arctin has antioxidant effects on hair follicles and may be beneficial for alopecia prevention and treatment. Arctogenin protects against hearing loss by enhancing survival and growth of neural stem cells in the ear. Burdock root has been shown to be safe in animal studies, up to 8 weeks of consistent consumption. The tannins in it may cause stomach upset at high concentrations and have some dangerous side effects such as nephrotoxicity and hepatic necrosis. Burdock oil may cause contact dermatitis when applied to the skin. Metabolites of burdock root may be excreted via bile and urine.